of the area, cauterize the surrounding area, and we looked at very carefully the position of the stem, the angle of the femoral component, sizing of the component. We couldn't come up with any correlation except in one or two patients that the patella baha and tilt in the patella. For whatever reason, some knee you end up, so the patella doesn't sit like this, it does this. So in that kind of a knee, maybe you change the joint line, that may be responsible for that, but I'm not sure. So I could summarize by saying that put the femoral component where it belongs, in terms of joint line, in terms of flexion extension position, in terms of sizing. If you do all those, that knee should do better than the knee where you don't do these things.
Yeah, my caveat experience was, and I have not looked at this, but I had used a round patella in my prior experience with a different company knee, and when I went back to Sigma, I went with the round patella, and I actually had some people with entrapment problems, and so I went back to the oval patella, and it seemed to be less. Now I haven't looked at those numbers, but and you know, I think if I looked at the 700 knees that I've done, I know that's a penance to your number, but I haven't. The only people I've done a lateral release in have been patients who've had